My name is Emily Prefer. I live in Lindenhurst, New York, but I go to college at Malloy College in Rockville Center. And I also work in Lindenhurst at a private pediatrics office. When the initial quarantine began, I was working at the job that I'm still working at, and we also shut down. The laws or the rules were a little unclear as to whether medicine could be opened or if it was just emergency medicine. So we weren't sure if we were included in, primary emergency healthcare. Since the quarantine was lifted and social distancing was put in place, my job was able to definitely lighten up a little bit. We were able to go down to regular masks at one point. We weren't using the N95 masks we had been using for the past 3 months. And we were able to see a little bit more patients. So although we are still not seeing any sick patients, we were able to take in older kids instead of just the little babies. But overall, I think the pandemic has really affected my job and affected the way that we function there. Working with little kids and with babies, there's a big disconnect now because these kids are honestly scared looking at us and not knowing who we are under the masks. And so there's no connection anymore. Being a nursing major, I do clinicals, so I do go to the hospitals every semester, and that was the biggest thing that was affected. Classes were held online, of course, like everyone, but as soon as quarantine hit, we were not allowed into the hospitals anymore. We did online assignments for it, but I never got that patient experience in the hospital. And yeah, ever since then, we haven't been allowed on campus. We're still all online. So that's definitely, a ripple effect from COVID that is still following us. We still are not getting that patient experience that we should be getting. One positive way or one benefit that I got out from this whole quarantine and the whole pandemic, I think definitely, although I wasn't working in a hospital setting and I wasn't working with COVID patients, I definitely think I learned some aspects and some ways in which to deal with a pandemic just from working in the pediatrics office. I don't think it's comparable at all, but I think it just gives you somewhat of a taste of what it would be like working in the hospital during a pandemic. It's something that's kind of like unprecedented. Nobody really knew how to handle this.